Simple eyeball exercise that you can practice is looking up, looking down, looking side to side multiple times in a day. Sensory priming is an alternative to electrical stimulation. Pull your ear front and back for the count of 10. How to regain your facial movements after Bell's palsy. If you who are someone who has recently developed Bell's palsy or facial paralysis, then this video is must watch, because I'm not going to give you some quick fix exercises because that doesn't work at all. But I'm going to give you a roadmap that with over 10 years of experience in this particular space and helping around 1000 plus patients suffering from Bell's palsy and synkinesis, we exactly know what works and what not. So this video is going to be an eye-opener for you. So make sure to watch this video till the end. Let's begin. Friends, whenever an individual suffers from Bell's palsy or facial paralysis, their biggest wish or desire is to regain their facial movements as soon as possible. But that's the biggest mistake that they make. And that's what we try to explain to every patient of ours. Don't hurry or don't try to regain your facial muscles faster. Instead, your goal should be to attain your facial movements back as same as they were before. Because when a person suffers from Bell's palsy, if the recovery and rehabilitation doesn't go right, they are at risk of developing something called as synkinesis, where the facial movements, even though come back, they come in such a way that the face doesn't feel the same. And all the facial movements feels distorted and out of place. The idea of rehabilitation is to prevent this issue as much as possible. Recovery is something that's natural, which eventually will happen. So make sure that whenever you are working towards helping your facial muscles come back to its original position, train to regain movements in the as natural way as possible, not as fast as possible. Now, if this is clear, let's begin what should be done so that you can attain the best outcome from your Bell's palsy. Now, the Bell's palsy rehabilitation can be divided in total 8 steps. Yes, you heard me right. There are 8 steps that needs to be followed and taken care of very properly so that your facial movements recover. I also see many a times people think that Bell's palsy is not that serious condition. They don't take it that seriously. And when the recovery doesn't happen as expected, they get frustrated and they feel that movement will not come back again. But that's not the case. Patience is an ultimate game changer here. And following these 8 important steps in the right manner is going to be the game changer here. So now let's have a look at these 8 important steps. Step number 1, and the most important one here, is application of warm compress. Whenever you have developed Bell's palsy, make sure to start applying warm compress or heat compress every single day. This helps not only to improve the blood circulation, it enhances the lymphatic drainage and at the same time soothes your sensory nerves and to certain extent it stimulates your sensory nerves as well, which helps in recovery overall. It's not directly connected, but it reduces the pain, makes the muscle feel relaxed and supple and helps the patient to feel good about their face. Along with that, it reduces the inflammation on the back side of the ear. So now the question arises, how should this heat compress be applied? Well, it's very simple. You can take a simple electric heating bag or else a hot water bag or else a microwavable heat pack and then place it on back of the neck, on the cheeks, on the nose, on the eyes, on the forehead region. Place it for around 10 minutes and you will feel a lot of relaxation on these face muscles. Remember this, these facial muscles will be at risk of developing tiredness and stiffness as they are not functioning normally. That's why heat fermentation is very important. After warm compress application, what comes next is your eye care. Since your eye is not blinking properly, it's at risk of getting infection, inflammation and more tearing. That's why taking care of your eyes with the help of tear drops, making sure that you passively blink your eyes and you continuously stretch your eyelid is very critical. It's not just the upper eyelid that you have to work, you need to make sure that you give adequate supported lifts to your lower eyelid as well, because the eye muscle is a circular muscle and when it gets paralyzed, it's not just the upper eyelid but the lower eyelid which is not functioning as well. Along with this, doing eyeball exercises helps to maintain the eye coordination, which somewhere gets impacted while you recover from Bell's palsy. Simple eyeball exercise that you can practice is looking up, looking down, looking side to side multiple times in a day. This way, indirectly, you will involve your eye muscle without further contracting and straining these muscles. Let's move to the third principle that you have to follow in your Bell's palsy recovery, and that is facial massage, the most important aspect of your Bell's palsy recovery. The facial massage can play a very important role not only in helping your facial muscles to regain movement, at the same time making sure these facial muscle properties are maintained well. When you talk about facial massage, it's not just a random massage that needs to be followed. There are a step-by-step practices that follows the anatomical principles of the facial massage that needs to be practiced. For this, it's highly recommended that you should work with an expert therapist who understands Bell's palsy and facial palsy rehabilitation and can help you to work with these massages. The next is sensory priming. Sensory priming is an alternative to electrical stimulation. Well, the function of electrical stimulation is to passively contract a muscle which is not moving. The same effects can be achieved with other modes of sensory priming like simple tap, touch, stroking, and even vibrations. When this sensory priming is done on the facial muscles, it leads to increased awareness, it leads to activation and stimulation of the facial nerve without over-contracting them, giving a safer alternative to electrical stimulation. Next comes a nerve glide, which is very important to ensure that there is some mobility that is attained on the facial nerve. How to do this nerve glide? It's very simple. Make sure to hold your affected ear with your hand like this. Place the other hand on the back in this way. Now first, do circular motion of your ear 10 times clockwise and then 10 times anti-clockwise. Once done, hold your earlobe, pull your ear front and back for the count of 10. With this, you will be able to mobilize your facial nerve, which sometimes gets stuck because of the swelling that happens. Next comes your facial stretching. Now, facial stretching needs to be done on the good side of the face because that side of the face is overcompensating and overcontracting to make up all the limitations that is present on the affected side of the face. That's why doing facial stretching of the good side in the centering direction is very important. And then comes your facial exercises. I have said this again and again many a times. When it comes to facial exercises, please follow this rule of doing passive facial movement over active or active assisted exercises when you are in initial phase of Bell's palsy. When few weeks will get over, you will realize that certain muscles will start showing some contraction. That is when you should start doing active assisted exercises where you are applying partial support to your affected muscle and partial contraction is done by yourself, which gradually needs to progress towards active exercises followed by resisted exercises. That's how the progress should be. It should not be abruptly like first day of Bell's palsy and you are trying to close your eyes very strongly, you are trying to laugh very loudly. This is not going to happen. In fact, you are going to hamper your facial muscles, you are going to strain your facial muscles, will lead to synkinesis and facial pain. Now comes two more additional pieces which are not directly involved but play a very critical role when it comes to your Bell's palsy rehab. Number one is your mental health or else your emotional well-being. The more motivated you are, the more positive you are towards your recovery will also be better. If you have negative thoughts, if you feel frustration, which is obvious to happen, but still you need to overcome these emotions because these emotions can hold you back. That's why taking help of a mental health professional can further help you to deal with the scenario or is the emotional challenges that you are experiencing with your Bell's palsy. That's not all. Along with your motivation, patience matters a lot here. A positive patience will help you to sustain your facial practices on a day-to-day basis and will allow you to regain your facial movements in as ease as possible. And then comes the last piece, and that is your nutrition. Your healing depends on your nutrition, because if you are deficient in certain nutrients, if you have more inflammation in your body, then definitely you need to work on that, and that can be done with the help of proper nutrition or else diet. That's why at HQR we have created a holistic facial palsy rehab program where we cover all these important pieces that I mentioned in this video to ensure that you can recover from your Bell's palsy in the easiest and best possible way. Remember, the quality of movement is far more important than your speed of recovery. Yes, recovery is important and it will happen, but more than that, you should also focus on your facial muscles so that when they come back, they start moving and functioning exactly the way they were functioning before. I hope this video was helpful for you. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.